want to change for a moment and talk a little bit about what we do. It's fair to say that we are at a pivotal moment in the history of human medicine. The last 9 months has seen such changes in the discoveries about how to use genes as medicines that they are truly transformative. It's like an Uberization of medicine. Many people didn't see it coming, many people didn't imagine it was possible. But what we've actually seen approved in the United States and expect to see approved very soon in Australia are gene therapies that are capable of curing inherited diseases and cancer. So I'll give you the example of the 2 inherited diseases that we have just published in the last 9 months in the New England Journal of Medicine. 2 separate reports, one on haemophilia, the bleeding disorder. 10 out of 10 patients, a single injection that cured them of that disease, and there's no reason to imagine that that cure is going to change in the coming years. So that's the big word, that's the cure word, that's the one that I think you remember all that famous joke from the cynical pharmaceutical industry executive who's telling his staff, well, why would I want to cure a disease when I can get patients keep coming back and paying for it every week? And so this is the transformative difference. This is the change in medicine where we've shown that we can cure a disease and a single injection, no more injections are required. The other example is in the even more common disease called thalassemia, also reported in the New England Journal of Medicine, clearly the journal of record in our field of medicine and the most prestigious medical journal in the world. In that case, not everybody was cured, but indeed a number of, the majority of patients were free from their requirements of regular blood transfusions throughout their lives. The last example that I'll give is a trigger to introduce the recipient of a prize this year. That is the Rotary Cure the Future Fellowship. Dr. Gerard Hsu is the recipient of this year, and Rotary Chatswood has contributed funds along with Cure the Future to make a fellowship available to him, to give him transition funds to do the research that is transformative, not on an inherited disorder, but on cancer. There are a number of people in the room who, of course I won't mention, who are cancer survivors, and they are the people who drive some of the research that Gerard is doing, as well as some of the research that I've just mentioned. And I made mention earlier of a pivotal moment over the last year, which is transformative. And that has been the approvals, for example, in the United States, of 3 new gene-based drugs. 2 of them are cancer drugs, and 1 of them is a gene therapy, of all things, for blindness, an inherited form of blindness called Leber's congenital amaurosis. And the funny twist is that Mercier's beautiful painting is a painting, a representation of the retina, which is a beautiful connection between an approval of a drug that is a gene-based drug injected at the back of an eye, a single injection, and believe it or not, cures blindness in babies who are born with this disease who see, and then over the following years become completely blind. And this transformative gene therapy has been approved. It's not an experiment anymore, it's available, but only in the United States, and we hope it'll be available here in Australia soon. But the 2 other approvals were cancer immune therapies. And so what Gerard's PhD is devoted to doing, and indeed my Department of Cell and Molecular Therapies at Royal Prince Alfred Hospital, in concert with the Gene and Stem Cell Therapy Unit at the Centenary Institute at the University of Sydney, several of the scientists here tonight, please ask them questions, are working on these questions, is to reprogram one's own body's immune cells to target one's own cancer. That concept has driven people for decades, but it's been impossible to achieve. And what's now been achieved in 2 diseases, in lymphoma and in leukemia, a particular subset of leukemia, we can take cells from one's own body, genetically modify them so that they now reprogram to target cancers. This is a revolutionary, pivotal new technology, and I'm glad to say that we have it available in Sydney. We're developing it in Sydney in the lab, and we hope that in the coming year or 2, we'll make it available in an experimental form for not the 2 diseases that I mentioned, leukemia and lymphoma, because we've already done that in clinical trials, but make it available in so-called solid tumours like mesothelioma, pancreatic cancer, and a form of soft tissue cancer. So we're very excited about that. We already have significant funding, but we need more, as is obvious, and that's what drives us to be here tonight, and I thank you all for joining us.